Mrs. H&P is a pleasant 65-year-old female patient with an overall benign medical history until recently. She is a current patient of Dr. Kai at the Gastroenterology Clinic. A complete gastric workup has been performed and she has been found to have multiple colon polyps that are unresectable by colonoscope. On 6/16/2015, Mrs. H&P was admitted to the hospital for laparoscopic extended right hemicolectomy with Dr. Norton. Our hospital service has been consulted by Dr. Norton for management of acute post-operative hyponatremia. Mrs. H&P's pre-operative sodium levels were 136, and this morning her post-operative sodium is 130. Her exam is overall negative. She is alert and oriented and serves as a good historian. She is in no visible respiratory distress and denies chest pain and palpitations. She is positive for intermittent nausea. She denies dysphagia, heartburn, dyspepsia, and vomiting. Is positive for constipation this hospital stay. There has been no blood in her stools, and she denies diarrhea. She is voiding clear yellow urine. She denies muscle weakness. She denies excessive thirst and excessive sweating. She denies headache, confusion, and dizziness. Her only complaints are those related to pain associated with the surgical site incisions. Her weight this morning was 75 kilos. Her height is 64 inches. No weakness, fever, chills, or fatigue. Her blood pressure was 112/72. Heart rate is in a sinus rhythm at 97 beats per minute. Her respiratory rate is 14 respirations a minute, even and unlabored. She is afebrile, 98% on room air. Mental status, she is alert, awake, and oriented. Speech is fluent and repetition is intact. Her mood is euthmic. Affect is appropriate for this situation. Thoughts are appropriate, no evidence of disorderly thinking. Thoracic expansion is symmetric. Breath sounds were clear to auscultation bilaterally. Her heart rate is regular rate and rhythm. S1 and S2. S3 and S4 are not discernible on examination. No JVD is noted. Her abdomen is non-distended, non-tender. No organ megaly is noted. She is not guarding. Bowel sounds are hypoactive to auscultation but positive for flatus. Abdominal aorta was clear to auscultation with no bruit noted. She is voiding. No joint tenderness, deformity, or swelling. Noted equal strength bilaterally, intact range of motion, no erythema, warmth, or tenderness to her joints. Her skin is warm and dry with no rashes. Skin appears to be intact except for 3 small abdominal surgical incisions on the right side of her abdomen. Mrs. H&P is a pleasant female with an overall benign medical history until recently. She has presented with hypotonic hyponatremia following her laparoscopic hemicolectomy and will require a complete workup for the etiology of this hyponatremia, including rule out of syndrome of inappropriate antidiuretic hormone. Differential diagnosis are hypotonic euvolemic hyponatremia and syndrome of inappropriate antidiuretic hormone. For the hyponatremia, we will assess volume status by checking a serum osmolality. We will check a random urine sodium. We will change her IV fluids from D5 1/2 NS with 20 of KCl to a 0.9% normal saline at 80 cc's an hour. We will check a chemistry panel 6 hours after IV fluid change. We will check a chemistry in the morning. We will check a CBC. For the SIADH, we will assess acid-base status by checking an arterial blood gas. We will check a thyroid panel and check urine osmolality. We will also order a free water restriction. For this patient's chronic constipation, we will increase ambulation orders and add stool softener Colace 100 milligrams PO BID. The right colon polyps that were unresected by colonoscopy has been resolved with the laparoscopic extended right hemicolectomy by Dr. Norton on the 16th. For the postoperative pain, we will order hydrocodone 500 milligrams PO Q4 hours PRN for pain. I have discussed with this patient who would be her surrogate decision maker for her if she became unable to make decisions, and she has stated it will be her husband. She is a full code. We would like to thank Dr. Norton for the opportunity to provide care for Mrs. H&P throughout her hospital stay. Thank you.